I would do
in the consent.
That's great. Yeah. Thank you very much. It's recording now, so that's brilliant. Well, thank you very much for agreeing to do this, and I know we've only got about half an hour, so I'll make sure I keep to that time. Thank you. Really what we're trying to do is, from the working conditions survey that Jermaine previously conducted, there are some areas which people talked about that could be used to improve working conditions, and we just want to ask from your point of view, what do you think might improve them? And that might be, something within the organisation, it might be a macro issue, a social issue, a really broad issue. I can give you some signposting if you want to, of the kind of things that came up before, or I can just leave it really open if there are things that you know straight away that you think would help.
Okay. Now, can I just be clear, because although it talks about social work, and my reading of some of the questions it was more geared towards frontline social work staff.
Yes.
As a manager of quite a large team with assistant managers, and I'm okay and valid, as it were, to be part of this.
We're as you say, we're interviewing a whole bunch of frontline people, but we've also been doing quite a lot of interviews with managers, because we really need to know from your perspective, what would help. So that's why I'm saying sometimes the individuals talk about very specific, perhaps more micro things, whereas the managers come at it a bit more top down. That's absolutely fine.
No, that's okay. So also, are you wanting me to say what I think about my own working experience and conditions, or you wanted me to say about others, my perceptions of, or both? Or
if you've got time. I know.
Yeah. Shall I start with my own?
Yeah,
my own's easier.
Yeah.
And can I just confirm before we continue on being recorded?
No.
But I mean, the findings of all these things are then sort of confident. What I'm trying to say is the findings aren't attributed to certain individuals with this or that.
Absolutely not. We are not allowed to, under all of the ethical GDPR, all etc. guidelines. So when we've recorded everything, it gets downloaded, it gets fully anonymised. So not any names, but places, any other identifying feature gets removed, which does reduce what we can report. But we know, that's just the way it has to be.
No, that's fine. I'm just checking as well before I be honest.
Yeah. I know.
So I would say, and I think this has reflections for lots of other people, so I don't wish to appear precious because I'm not alone in this, but speaking for myself, the main thing is just sheer volume, absolute volume, and I'm an efficient, organised person, practitioner, manager. Over a number of years I've had the practice of getting better at all those things, and notwithstanding we can always learn a new trick, but just absolute volume and the ridiculousness of even being able to achieve anything close to your 37 hours paid contract.
Yeah. And do you think that's got worse over, is there a time frame that you think that's got worse in, that you could...
It's hard. I find that really hard because I worked in the public sector, local authorities for a number of years, then I went out into the independent and private sector for a number of years, and I've only been back into the public sector for about 4 years in August, okay? And I've been in this job for about 8 months. So, because of that, I can't say... I think it's got a bit worse in relation to emails and information, right, in the last 3-4 years, in the time I've been working in Wiltshire. And I imagine that's a national situation. I don't imagine that's a Wiltshire, specific thing. So I think I can say that I'm conscious of getting worse. And I can't remember the exact data because I forget things like that. But I know, over the recent years there's a significant increase in work in terms of the front end safeguarding, the volume of course, whereas I'm working with children in care and the fostering scenarios and kinship and whatever, obviously it all filters through, doesn't it? So there's been a significant increase in work. There's a continuing struggle with staffing. We've made some progress locally in regards to our introduction in some teams, and hopefully soon mine, of aspiring managers and who manage ASYEs. And so we've got a lot more ASYEs within, which is better than having vacancies, but of course it brings challenges as well in terms of the balance of some teams. So where we've made progress in that regard, there's still, most teams like mine right now is carrying about 5 vacancies, which is, most of last year we were running at about 65-75% of what we should have. So, and some of these things, 2 weeks, 3 weeks, a month, no big deal maybe, but, week on week on week on week, it's hard, staffing and the sheer volume of work and the noticeable volume of emails and so much information.
Yeah.
You know, just overload. So I think now, for me, I've long been a believer of that kind of, I guess there's some research on it, but, you know, the idea that stress is there's a kind of relationship between responsibility and autonomy.
Yeah. Yeah.
So, I think a lot of social workers have a lot of stress on them because they feel a lot of responsibility.
Yeah.
And some of that's real and some of that's perhaps some people could be better at realising they need to share that and not own it. But anyway, the reality is there, I think, for many of them, and have very little autonomy.
Okay, yeah.
So I think that's very stressful, whereas I've worked at more senior positions in the private sector before, and although you could think of having more responsibility has been bringing its own and different stresses and pressures, when you have the ability to action and make decisions, you kind of relieve that stress, I think.
Yeah. It sounds, am I right, you're sort of talking about, in psychological terms, demand support controls. If you've got a high demanding job, but if you have some support and some control, then it's a lot better than, if I understand from what you're saying, you've got the demands but not necessarily the control, the autonomy.
Yeah. Okay. Yeah, no, exactly. I hadn't heard it that way before, but that's better. Yeah, that's good. Yeah, and that's exactly what I mean. And I guess from the support angle, if we're thinking of the demand being partly around the volume, you know what I mean? And if you're in roles where you're thinking, I've got to do this, I've got to do this, I've got to do this. So yeah, but then it's kind of, then you kind of keep on going down that road, and then also, somebody who's been less effective, less, you know, that can mask all that. So you just what I mean. So there's also room for people to be effective and be more effective and work more efficiently and do all those things. But I think that in terms of just sheer workload for some people and then that culture, it can be overbearing.
Sure. Thank you. That's a lot of really useful information, Joe. Thank you very much. If I can pick up on some of it, and apologies if some of my questions might sound a bit simplistic, but what do you think will help? You know, when you talk about volume, I mean, apart from more resource, which I guess is part of it, is there anything you can think of that would help?
Yeah, I mean, I suppose when I'm saying that, I was talking very much about my own experience, in my role. But I guess, you know, I'm meant to have 2 assistant team managers. I didn't have one for 3 or 4 months. Right. And then I've got one who's been part-time for 2 months and starts full-time next month. So, you know, I mean, that's a significant difference, you know, because the team fully staffed is about 45 people, Right. So that's quite, you know, a big difference to one assistant team manager missing. Sure. But I'm saying that, but I know other people have had those experiences as well. I'm not the only one in my role in that way, you know. And so, and things like we've had a new, computer database system started in November, and it's got a lot of work needing still doing on it to make it fit for purpose. And so, you know, but then no one turns off the tap of work coming in whilst we're getting ourselves ready to, you know, to record and store it. If it just what I mean. So, in terms of back to that support demand thing, you know, it's kind of that adds to it really. And then, of course, you know, as has always been the case, I guess, the nature of social work at times. Many of us have been here for a lot of years. You get thick-skinned in some regards, or you learn to manage it. But actually, you know, you're dealing with quite unpleasant, difficult, stressful, sad situations on many occasions.
I take my hat off to you. I really do, for doing the jobs that you do. And in that regard, in the nature of it, is there anything that you can help? Is there anything that does help, or is there anything else that you'd like more of, or to be done differently, or not? Is it just the way it is? I don't know.
Again, it all comes back to just the volume and the staffing to do the volume, because for me in my role, I always see my most important task is to kind of keep my team happy. I don't mean just always been nice and making them smile, but you know, actually kind of they're my focus. So I kind of feel if I'm a good manager to me is somebody who that's their focus, and